This is Sara Konrad Baranowski with the Times Citizen, and I'm joined today by Dr. Katie Haverkamp from Iowa Falls Clinic and Hansen Family Hospital. Again, we wanted to have another conversation because there's no end to what people want to know or need to know about COVID and coronavirus. And Katie, you suggested this topic for today that we're going to start with, and that's the holidays, because we're we're a little more than a week out from Thanksgiving, and then Christmas is coming quickly after that. And people are wondering what they should do. Like, is it okay to get together with grandpa and grandma? Or what should I do if my kids come home from college? So do you want to just kind of start to talk through that? And is it safe?
When I think of Thanksgiving, I think of the lost and forgotten holiday, because I think like at least half of the people have their Christmas trees up already.
Do you?
One, yeah. No, I do not. No,
I don't either.
I am not doing that yet. No. Yeah. And I just get a big stomach ache thinking about it, because it just is just kind of a hit to everybody's gut with Thanksgiving and what the leaders are recommending now about the holidays. But I'm going to kind of go from what we had explained last time about what happens if you're exposed, or how long do you have to quarantine, and all that sort of good stuff. So there's some things that if you do get together with other family, or if you have kids coming home from college, that you can mitigate some things, but there's no such thing as 100% safe. And this virus spreads so much without symptoms, and without, you're symptomatic, or you're infectious a couple of days before you become symptomatic. So even if everyone's feeling great, has no temperature at the door, you could still have COVID Corey or COVID carry, and they could be spreading it to everyone unknowingly. So if you have people over, I would recommend, an outdoor event. I know it's Thanksgiving in Iowa, but if you could have something outdoors or the windows open, and masking for your people and social distancing, always going back to those general things of, if you're not sharing your breath with others, you're doing okay. So, but we can also connect through FaceTime and through video and through phone calls, and we can get a little creative with that. I know that if nothing else, we're creative people, but there's no such thing as a 100% safe, even if we do all of these things, that you might not introduce the virus to your family. Also, you might think, well, everybody's going to get tested before they come. Number one, good luck everybody finding a test, because everybody's thinking like you. And my kids are going through that right now. They're trying to procure a test coming in. They've been trying to be good for the past week. But I don't know. I don't know what they've been doing. We've been talking about things. They say that they're doing the things, but you don't know. So I would encourage your college students or your guests to self-quarantine for the 14 days prior to coming to your house. That would be the best way to make sure that they don't have the virus. And if they had a negative test coming in, you'd want to do that test, if it's through Test Iowa, at least 5 to 7 days coming in, because you're not going to get that result back right away, unless you do go to a quick antigen test site, which there are some around, but you just have to shop around. And I'm not sure that there is a running list of test sites other than going to Test Iowa or Googling it. But there are some antigen tests around here too that are a little bit quicker. You can get that same day. So that makes things safer, but it's not 100%.
So if you had, say one conversation we've had in our family is, there's a large heated garage, and we could space out in there. We'd still be inside, but we'd wear masks and we'd sit apart to eat. I mean, is there a safe way to do this, or is it just no? Like,
or you really, but are you sucking all the fun out of it just to be in the same physical presence as somebody,
Mm-hmm.
Or is it more fun to get together and have one big old party once everybody can, after the vaccine comes through, or after it settles itself down, going through all the rigmarole of making sure that everybody has their own placeware and doesn't touch each other's food. And, that'll drive you absolutely insane thinking about all that sort of stuff.
Yeah. So you have college kids. I mean, you referenced that they're trying to get tests. Is there, you said have them quarantine for 14 days. What if that's not really possible for them? I mean, do you want them to quarantine when they get to your house then, if they're coming home for Thanksgiving? I know some colleges don't have a break or they don't go back to school between Thanksgiving and Christmas. Like when they get to your house, should they go to their room and stay there and mask up when they're outside of their room?
Yeah, kind of. I mean, truly, I told my kids, one of them is, I don't know if you know which one would be the one that's following the rules and which one's not, but one of them's, got her tests all set up, and the other one's like, yeah, I'm looking, but I'm not finding. And I'm like, no test, no home. And if their test results aren't back, well, then they kind of are relegated to their area of the house. And if they're in a common living space, then they wear their mask. That's kind of going to be our rule. And we kind of have an air purifier too that we're going to put in the common room and probably air the things out. But for the first couple of days, at least, until their tests come back or until they've been home for a few days, it's not easy, and it's not going to be, per CDC guidelines. But, the thing about the virus is trying to figure out what level of risk you're willing to take and what you can mitigate.
Mm-hmm.
So it's a tough deal.
You referenced the CDC website. I know that they had good information about Halloween, and now they have some about Thanksgiving and Christmas. Just, here are the high risk activities and here are lower risk activities if you still want to celebrate in some way.
Mm-hmm.
And so I'll probably try to link to that with this
Mm-hmm.
video. But I mean, what are you telling people? Like, do the FaceTime, do the Zoom, do a phone call that day. I've seen some friends who set up a computer on the dining table and their family is on there, and, they kind of eat together. Like, you can see each other.
Right. Yeah. My own mother, she's already tapped out. She's got her own turkey. She's going to share some leftovers maybe. And, but she, it's not worth it to her, she knows she can see her grandkids other times, or that she can talk with them and connect with them in other ways. The physical presence for a holiday, or maybe two, in at least our family, isn't important enough. We haven't seen my husband's parents since this whole thing started, and they are taking it very seriously, and they have other health issues, and that's hard too.
Well, and really, I mean, that's what we talked about last time is, you might be okay, but the relative that you're seeing may not, or you may see a relative who's then going to go see an older relative who's maybe more vulnerable. And so you might unknowingly pass it on to that person in the middle. And then you're going to cause all kinds of problems.
Right.
And then we're also starting to talk about Christmas. I mean, at what point are we, like, I feel a week out from Thanksgiving is when everybody's kind of starting to talk about, okay, are we going to do this or no? All right, no, we're not going to. So Christmas, I mean, things could calm down by then, or are we pretty much, that's off the table?
I get another stomach ache when I think about Christmas. I don't think it's settling down because I see Thanksgiving, we're all still inside. It's still very cold out. And Thanksgiving, although a lot of us are doing the right things, a lot of people won't be. And then those people are together, and then it takes them a week to get sick, and then it takes them another week to spread it to other people. And we're going to have another little bit blossom coming over Christmas. I think it's not over. I mean, I think I want to be very hopeful, and I know that there's an end, but I don't think our end is Christmas. I think that with the vaccine coming out and them rolling it out in December, I'm super excited about the 2 vaccines that beyond excited from a medical standpoint. These vaccines look awesome. They look better than I ever thought that they were going to look. Plus they look safe. Sign me up. Yeah. Sign me up, because this is not a virus that this close to the finish line, I don't want to be tripping, man. I want to be getting that vaccine.
This isn't really switching gears, maybe a little bit, as long as we're talking about vaccines. The flu vaccine, I think I saw today that Iowa is reporting high flu activity, or influenza activity. And I didn't know obviously we should, if we can, I'm sure you would advise us to get the flu shot. But are you seeing people already who have influenza?
I think we've seen a couple things about flu. We've seen a smattering. We've seen a few cases, but we haven't seen it to be widespread. I think that on the CDC website, I saw that we were someplace with maybe mild to moderate activity. And that's actually a pretty quick flu season. But what has happened in the other years is that our first couple of flus are sent to the state and they verify whether or not it's a true positive or a false positive. Well, with COVID, they're not doing that, and you're just like, well, you know, treat it as a true or treat it as a negative. But unless you have a very, very good reason for not getting the flu shot, get the flu shot. There's just no reason not to have that extra layer protection.
Right. And you don't want to get ill and have to go to the hospital because it's full of COVID patients.
Right. When we're swabbing for COVID, a lot of times if they have influenza symptoms too, or if we're worried about influenza, we're swabbing them for both. So, yeah. But until it gets to be a little bit more widespread, we're not doing that on a regular basis.
So a few other questions. We got some questions from people who sent us questions. But before I get to that, there was one I wanted to ask because I've just seen this quite a bit. You know, there was this belief early on that if you got it, then you were okay. You had, you know, you weren't going to get it again. But now we realize there's a chance of reinfection. So if you've had COVID, which a lot of people do right now, and you recover, you should still practice all of those mitigation strategies. I mean, you should still be wearing a mask. You should still be distancing.
Right. Right. But first, okay, so I enjoy your question and remember our question, but I wanted to talk about testing at Hansen Family Hospital.
Oh, yeah.
Just so that we knew what kind of tests we were doing here, what that strategy was. If you want to seek about getting a test locally, what you need to do if you think you have symptoms, number one is self-isolate. Go home, don't get and contact your provider about testing time. The test we're currently running as of now is called the antigen test, and it's different than the PCR test that we were running last week that we ran low on. The antigen test has a window of, we like to be having you be 2 to 7 days in your symptom phase before we test you. So we don't want you to come too early, but if we call you, we can get you on the schedule. Okay, so please don't wait until you're that sick. But if they say, hey, let's test you in a couple of days, there's a reason for that, because a lot of people test negative too early in this. So so just call your provider in town, we'll, or at the Hansen Family Hospital, and we'll get you all hooked up. We've been doing a lot more testing, and we're trying to get people taken care of. Also, Hy-Vee does it as well, but their tests, we get your tests within 24 hours, and usually that same day.
And so, I mean, other than that 2 to 7 day window, is there, I mean, I think, are there any major differences between PCR and antigen? Like, it's still the same kind of test?
No, if you really want to geek out on tests, PCRs, PCRs actually are more sensitive, and basically that means if you have a positive, it's a true positive, and there's hardly any false negatives. Okay, so basically, if you have even just the tiniest bit of virus, the PCR is going to catch it both on the front end and the back end. So even though you're not still, you've been sick for 12 days and you feel fine, your PCR might still be positive. And on the other side, you might, like Chuck Grassley, you might have just gotten exposed and you don't have any symptoms yet, and your PCR might be positive. So actually the PCR is a more sensitive and specific test, but it's not as widely used, and it's a little bit harder to run, and we're actually low on that one. So we're using that mostly for the sicker people, like in the ER or needing to be admitted or transferred. We are not doing regular COVID testing through our emergency department. So that's very, very important to know as well, because, like, hey, I'll just go to the ER, they'll give me my test. No, they won't. They may swab you, but unless you're critically ill, we're saving those for the testing times to make room for the people that actually need to be definitely seen seriously ill in the emergency room. So please kind of take the process that's been working with us and going through the testing process without just showing up to the ER because you think you might have it and you don't feel like you need to be admitted.
So call that number, the 648-7113. They'll connect you with a provider. You will talk to the provider and they will say, yes, you need a test. And then you'll schedule a time and you'll go to that drive-through or the ER spot where you take the test. And Hansen Family Hospital is not doing tests on asymptomatic people. Like if you just have been exposed to one test.
In a beautiful world in which we had enough testing, we would love to, because when you're testing asymptomatic people, then you're testing the people that are spreading it. But right now, with our testing numbers and our testing capacity, we can only do the people that are exposed and symptomatic or just symptomatic. So the people that have been exposed, it doesn't change anything that we tell you to do, because we still want you to self-quarantine for 14 days. And there's, again, remember, no get out of COVID-free jail.
Remember.
Right? Yeah. So
So of the PCR antigen, you talked about false negatives where you do have COVID, but it says you don't. Is there a false positive with either test?
There can be if you're testing, it's more common if you're testing a population in which the incidence is very, very low. But
Okay.
this is kind of like a pregnancy test. If it's positive, you're pregnant. There's
Yeah.
not a lot of other reasons to be tripping a positive pregnancy test.
Right. So if you got a positive COVID test, you have COVID.
Believe
You
it.
need to go home.
Believe it.
Yeah.
Yeah. Oh, your antibody, or what were we talking about
Yes.
before?
I was reinfection. If you've already had it, do you still need to follow the mitigation, or can you just like walk around and you don't have a mask
you got to
on?
follow. Yeah, you would like to, and it would be nice. And you would there probably is a period of time in which you are immune, but we don't know what that period of time is, and we do know that your immunity wanes, and we don't know. So you still need to do the things.
Okay. So no matter what.
Right. Yeah. So yeah, like for instance, my son Luke got an antibody test thinking, if he got it positive, then, it would make us all feel a little bit better. And it would, but it was negative. And he's like, how can it be negative? How can this be negative?
Well, but if you get the positive antibody test, as we saw in the governor's press conference today, you can donate plasma, and that would be helpful.
Yes. Very good.
So the questions that we got from people, there are only a few, but the first one, are there any vitamins or supplements we can take to boost our immunity to coronavirus?
Nothing's really been proven to be helpful in the studies enough for them to put it on the guidelines, but there are some things that people are doing that don't hurt and might help. And some of those are like vitamin C. The numbers I've seen, and Dr. Manaz Badad, one of my partners at the Al Falls Clinic, is the person that geeks out on all of these things. But I kind of follow her because she's following everything else. But she recommends to her people vitamin C, 500 milligrams twice daily, vitamin D, 1,000 to 2,000 international units daily, zinc like a Zicam or an airborne. And people that are pretty sick, not just the mild cold symptoms, but people that are, high fevering and taking a lot of Tylenol, a lot of ibuprofen, Pepcid, or ranitidine. Well, ranitidine's off the market, but Pepcid twice a day sometimes helps with acid reduction and decreasing inflammation as well.
Okay.
But those other medicines that you hear on the news, as far as the remdesivirs, the dexamethazones, those types of things are for pretty ill people that need hospitalization.
And this is more like, I don't want to get COVID, and I want to be as healthy as I possibly can so that my body can help me fight it if I do get it. So vitamin C, vitamin D, exercise, eat healthy.
Yeah, let food be thy medicine, Sarah. Yeah, let food be thy medicine. Just basically eating a healthy diet. Don't eat a lot of junk food. Don't drink a lot of alcohol. Get plenty of, I know it, fun hater.
We have all those fun-sized candy bars sitting around the house.
It's Halloween. We didn't skip Halloween.
Well, we skipped trick-or-treating, but we didn't skip candy. So the second question, somebody said, I've been told that if you have a test done, it can cause future problems with insurance and pre-existing conditions. Is that true or false? I'd also seen something about this, that somebody applied for life insurance, and I don't know if that's really in your wheelhouse, but somebody had applied for life insurance, and one of the questions was, have you ever tested positive for COVID?
Shut up, really? Whoa.
But I mean, I think, while you can't answer that because you don't offer life insurance, we really don't know what happens after you've had COVID, right? I mean, this is new, and we just don't know.
Well, this is more of a, this kind of goes right on the heels of political, doesn't it? With everything, like pre-existing conditions will not be covered. But, well, I mean, when I started practicing pre-existing conditions, they'd put riders on your insurance, and, if you had asthma, they wouldn't cover anything for asthma. And it was tough, or you'd have to pay a lot of extra money for your asthma or whatever. Well, in the last 15 years or so, that hasn't been the case, and that's been nice. And so that's something that we would like to offer as protection. But I don't know about the whole life insurance deal, but I guess that could be a deal. But I mean, I'd still want to know if I had it. And I think for the public health benefit, I'd want people to get the test so that we can figure that out.
Right. Don't not get a test because you're afraid of an insurance thing.
No.
Right. The other question I think we touched on a little bit, are antibody tests available to the public? This person thinks they may have had COVID in January and they wanted to test to find out for sure. Hansen Family Hospital doesn't do the antibody test.
We do. We can send out for it. We can draw blood and we can send it to your insurance and you can get an antibody test. But the question is why? What are you doing? You know, what does it give you? It doesn't give you the whole, I don't have to do the things thing. Plus, you're the only guy out there not wearing a mask during a mask mandate, and you're like, but I have the antibodies. No, it doesn't kind of work that way. Maybe someday it will afford you some protection. I don't know. But if you get or secret time, you can get the antibody test through donating your blood. If you go to LifeServe, you donate your blood, they check everybody for the antibodies. So that's a free way to do it. Plus, then you would be tagged for possibly being a convalescent plasma donor, so there's that. So that's just the easiest way that I've told people, if you want this and you want it to be covered and you don't want to pay a couple $100s for a test you don't know what to do with and you're just curious, then do it. But if you say that I know I had it in January, you know, I had this bad cold and I know I had it, and by January, you know, by now I would be very, very surprised that your antibodies would still be there because they've been seeing them follow up. I'd be more inclined to think that you'd had a more recent infection.
Okay. Last one we got. What should a person do if they know someone has COVID and they're still going out in public and dining with friends? What do you suggest, Katie?
That incites violence, right? So I'm not inciting violence.
Don't incite violence. I mean, stay away from them. Like,
yes. I mean, you know, if people are worried about getting a stink eye, I think that would be a good thing for getting a stink eye. I don't know. But I don't know what you can do other than, you know, it's not like you can, you know, I guess you could call them out. And I'm like, hey, looks good. I see you're feeling better from your positive COVID test on Friday. I thought that was a 10-day quarantine. I don't know. I mean, what do you do other than, oof, I don't know. Yeah.
I don't know either. I think keep your distance.
Yes,
I don't know. I suppose it depends on your personality. I probably wouldn't say.
Right. And, you know, and maybe you don't have the facts either. You know, maybe they did have a COVID test on Friday and it was positive, but maybe they'd been symptomatic for 8 days and their get out of jail free card was 2 days later and it's now been 3. So, I mean, you know, number one, before you do blanket party, I would recommend that you don't, or you confront the person, not inciting violence, that you'd have your facts straight, but because everybody has a different situation.
Right. Yeah. And I think, you know, just distancing yourself, maybe don't go into social situations. I don't know.
But, you know, so if everybody wanted to cut out here, I'm going to geek out on epidemiology a little bit. But if you're kind of wanting to geek out on epidemiology and how we fight the virus, and for those people, you know, I had somebody private message me and say, okay, I hear all these things. I've kind of been on the no mask wearing. I don't believe it that much. And I see, you know, I read all these things that masks don't work and people that are having mask mandates are still having spikes in their regions too. The things that I read say it doesn't work. And she private messaged me. She goes, if I put this on Facebook, I'll be murdered. And I said, yeah, you probably would be crucified on Facebook. And thank you for bringing up the question because it's a very good one. But my response to that is masks do work, and it only makes sense that you're not sharing your breath with somebody, but it's not the only tool we have, or it's only one piece of the puzzle. And in epidemiology, you have to do a lot of things on a lot of different levels. Number one, you got to have your scientists at the helm, you know, figuring out where the hot spots are, getting the testing done so that they can isolate and quarantine people. You know, you need people to say, okay, we're coming up here. We need to get our people here so that we can quiet that down like they do at the nursing homes. Sometimes, or at least they used to. And then you have to, you know, do the testing and the contact tracing and the isolating and the quarantining. And what did, you know, so since we started those mask mandates, or since we had our last spike, what have we been doing? Well, we started school. We opened up businesses. We started going to sports activities. So there's all these things that we've now been coming together and indoors and things, and we expected a spike and we're getting a spike. And this is exactly what we thought would happen. But what we're trying to do is temperate so that we can save some lives before the vaccines come available and save our healthcare workers. So again, with a coordinated response, epidemiology does work. The people that have been doing it well, even in our nation, some states are doing it very well or a lot better than others, and some aren't. And some countries are doing it better than us because they're doing the things. China's doing great, everybody. You know, they do all the things, you know, maybe in a draconian way, but it works. When you put the things together, it works. If you look at one thing and don't have everybody buying into the whole system, it doesn't. Which brings me to the, I was gonna ask you to put, I don't know if we have any NPR geeks out there, but I listened to On Point quite a bit, and Magna Chakrabarty had her own On Point coronavirus task force, and it aired on November 11th, I think. But goes through that very, very well and step by step. So if you kind of want to know how do we beat a virus, that's a good one to listen to.
Yeah, it's the ultimate group project. You all have to work together on it, right?
No kidding. Yes. Yeah.
And really, I mean, I don't like wearing a mask and I would like to go back to normal, but if this is what we have to do to have businesses open and kids in school, I think, you know, it's probably a small price to pay.
Right. I agree. I would rather do the things than not do the things. You know, if there's something that I can do that would collectively help everyone through this and get us through this, then, you know, if somebody, you know, from the whole non-maskers, I'm like, why not? You know, why not? If it's going to be helpful or even potentially helpful, or even if you don't think it's helpful, but other people do, you know, that actually have degrees in that, and that's what their life, what they do for a living, then maybe we ought to listen to those people.
Yeah. But you're hopeful about the vaccines. I mean, they sound good, right?
Super excited. Yes, this is not, this is not our forever, but it is our right now. So we need to, if we're not all tackling it, we're not doing our part. So if together we can, people.
Yes, I believe so. Yeah. Well, unless you had any other bits of wisdom you wanted to share with us, those are all my questions.
I could go on forever, but no, we should wrap her up.
We'll just keep this going after COVID, and we'll just talk about public health and epidemiology.
Yeah.
Who knew 2020 was going to be the year that we all became epidemiologists on the internet?
Yes.
Well, Katie, thank you so much for joining me again. I think you're providing really great information in a way that's easy for everybody to understand, and that's so vital right now. So thank you very much.
Yes, if anybody, I'm happy to keep the questions coming and happy to do so.
Yeah. Okay.